I want to start with a really early intervention, which is preconception care. Ideally, women would get their A1C under 6.5% before becoming pregnant. And this is going to reduce the risk of congenital abnormalities, preeclampsia, macrosomia, preterm birth, and other complications. If women have not been diagnosed with diabetes, but they have some risk factors, like they have a family history, maybe they have PCOS or obesity, then they can check their A1C to get a baseline and identify pre-existing diabetes so it can be treated before they become pregnant. Next, I would recommend seeing a dietitian to help with meal planning to ensure that women are eating a balanced diet, high in protein, high in fiber, and they're learning how to manage their carbs. Also, starting on an early exercise routine that you can really stick to. So, even if that's just going on a 10-minute walk after each meal, regular activity, it's really important for glucose regulation and a healthy pregnancy. And then finally, and I am a huge fan of continuous glucose monitors or CGMs. So with diabetes and pregnancy, you need to be monitoring that blood sugar very closely. So if you're not already, get on a CGM and change those settings to the pregnancy blood sugar ranges, which are tighter than the normal blood sugar ranges in diabetes. CGMs promote awareness and positive behavior change. So for women who are newly diagnosed with gestational diabetes, it can be a big change. Often they've never experienced any health problems, and suddenly they're thrust into the complicated world of diabetes management, and we ask a lot of them. They have to perform finger sticks at very specific times of day. And if they have a job or if they have other kids, it can be really difficult to stay on top of it. So a CGM, once again, my favorite thing, that would allow her to passively collect that blood sugar data in the background of her life rather than having to stop everything to do a finger stick. So that can offload a lot of the burden of diabetes management and improve adherence. She would also be alerted as soon as her blood sugar is above or below a certain threshold, rather than finding out once she finally has time to do a finger stick at the end of the day and maybe her blood sugar was running high for hours. A big challenge with diabetes in pregnancy is the moving target of ever-changing insulin needs and carb tolerance. So if you've had diabetes for a long time and you really feel like you've cracked the code, you manage super well, you really know your body, but then pregnancy can turn things upside down. And so that can be very frustrating. If you have a new diagnosis of gestational diabetes, it can also feel like a losing battle when the breakfast you ate every single day at 28 weeks is with no problem is now making your blood sugar spike at 30 weeks. So the blood sugar goals during pregnancy are very tight and they can feel pretty unforgiving. So it's easy to feel angry or discouraged. The key is to stay engaged with diabetes management and to adapt from new and unexpected information. So don't look at these moments as setbacks or indications that you're not doing it right. Healthcare providers are coaches who should focus on making sure that these women keep playing the game rather than just focusing on winning. So recognize her hard work and acknowledge the difficulty of the task, and make sure she knows that she has you on her team and that you will strategize together. We don't want her to feel like she's letting us down when things aren't perfect. I want women to be curious about your body. It's doing something really incredible and it's working very hard. So your blood sugar is behaving in a new and unique way during this period. Investigate it. Explore how the decisions you make and the environment that you're in can influence what happens inside your body. Food, stress, sleep, activity, they all affect your blood sugar. So you do have a direct influence on how your growing baby's environment, and there are well-documented outcomes associated with your blood sugar levels during pregnancy. So if you're interested in what's going on, you're going to learn a lot, you're going to feel more empowered, and your hard work will feel more rewarding.